Good day, everyone. I'm Antoinette Jane Delphine Autumn, section BSN2B, and today we'll be going to explore the phases of postpartum and possible complications, bleeding, and infection. Learning objectives. At the end of this report, students will be able to overview the postpartum period and its importance for maternal health, identify postpartum phases, and understand the possible complications, bleeding, and infection. To further our knowledge about this topic, let us first define what is postpartum. Postpartum refers to the period following childbirth, encompassing the physical, emotional, and psychological recovery of the mother. This period begins immediately after the delivery of the baby and extends to several weeks to months as the body adjusts back to non-pregnant state. The postpartum period is generally divided into three distinct phases: the immediate postpartum, early postpartum, and late postpartum. To start with the immediate postpartum, this phase involves the first 24 hours after delivery. Physiological changes include uterine involution and placental expulsion, maternal monitoring like vital signs, initial maternal-infant interaction like skin-to-skin contact and breastfeeding initiation. Physiological changes. Uterine involution, the process of the uterus contracting and shrinking after the delivery to reduce bleeding and restore its pre-pregnancy size. Placental expulsion, monitoring to ensure complete expulsion of the placenta and to check for retained fragments. Maternal monitoring, like vital signs, importance of frequent monitoring to detect signs of excessive bleeding or shock. Initial maternal-infant interaction, skin-to-skin contact, benefits for bonding and temperature regulation. The baby is usually placed on the mother's chest for skin-to-skin contact, promoting bonding and initiating breastfeeding. Breastfeeding triggers the release of oxytocin, which further aids in uterine contractions. Breastfeeding initiation, effects on uterine contractions, and early maternal-infant bonding. Nursing focus. Nurses must monitor for signs of postpartum hemorrhage, ensure uterine contraction, assessing vital signs, and provide immediate support and education to the mother. Next is the early postpartum, first week. During this phase, the uterus continues to contract and reduce in size, a process known as involution. Lotia or postpartum vaginal discharge gradually changes from red or lotia rubra to pinkish brown lotia serosa and eventually becomes white or yellowish lotia alba. Nursing care. Emphasis on observing for signs of complications such as infection and continued bleeding, providing support for breastfeeding, education to self-care, and mental health support are critical during this phase. And lastly, we have the late postpartum, 2 to 6 weeks and beyond. The body continues to recover with the uterus returning to its pre-pregnancy size by the end of this phase. Hormonal levels also stabilize and the mother's body gradually resumes its normal function. Completion of uterine involution. By 6 weeks, the uterus typically returns to its pre-pregnancy size. Return to normal activities. Mothers gradually resume their normal activities, though some may still experience fatigue or discomfort. Emotional and psychological adjustment. The emotional well-being of the mother continues to be assessed. This phase is critical for identifying signs of postpartum depression or anxiety. Now that we are familiar with the postpartum and its three distinct phases, let us proceed to the possible complications of it, the bleeding and infection. Postpartum hemorrhage, or PPH. Postpartum hemorrhage is one of the most serious complications during the postpartum period. It is defined as excessive bleeding of more than 500 ml after a vaginal birth or more than 1000 ml following a cesarean section. Causes. The causes of postpartum hemorrhage includes uterine atony. It is the most common cause of PPH, where the uterus starts to contract effectively after birth. Retained placental fragments. Small pieces of placenta may remain in the uterus, preventing proper contraction and leading to bleeding. Laceration. It is tears in the cervix, vagina, or perineum can result in significant blood loss. Coagulation disorders. Conditions that impair blood clotting can exacerbate bleeding. The prevention of PPH or postpartum hemorrhage is active management of the third stage of labor, AMTSL. It involves the administration of diuretonics immediately after the delivery of the baby, which significantly reduces the risk of PPH. Postpartum infections. Postpartum infections, also known as puerperal infections, are bacterial infections that can occur within the first 6 weeks after childbirth. These infections can be localized to the uterus or endometritis, or they may affect the urinary tract, perineum, or surgical wounds. Common infections. Common infections include endometritis, mastitis, urinary tract infections or UTIs, and wound infections. Endometritis. It is the infection of the endometrium, often resulting from prolonged labor, multiple vaginal examinations, or cesarean delivery. Symptoms are fever, lower abdominal pain, and foul-smelling nausea. Mastitis. Infection of the breast tissue, typically occurring when bacteria enter through cracks in the nipple. Mastitis infections are red, swollen, and painful breast tissue, often accompanied by flu-like symptoms. Urinary tract infections are UTIs, often associated with a catheter used during labor or delivery. Symptoms are dysuria, urgency, and fever. Wound infections. Infections at the site of the perineal tears or cesarean sections incisions. Wound infection symptoms are wound infections redness, swelling, and purulent discharge at the site of the incision or tear. However, there are procedures to prevent this kind of infections. Prevention includes aseptic technique, prophylactic antibiotics, and breast care. Aseptic technique. Proper aseptic techniques during delivery can significantly reduce the risk of infection. Prophylactic antibiotics may be administered to women at higher risk, such as those undergoing cesarean sections. Breast care. Proper breastfeeding techniques and nipple care are essential to prevent mastitis. In conclusion, the postpartum period is a critical time for the mother's health, requiring careful monitoring and management to prevent and treat complications such as postpartum hemorrhage and infection. Early detection and appropriate intervention are key to ensuring the well-being of both the mother and the newborn. And that concludes my report for today. Once again, I'm Antoinette Jane Delphine Autumn. Thank you for listening.